Surgery without anesthesia, the brutal reality of ancient Roman medicine. Here's a thought. Imagine you're fully conscious while a surgeon saws through your leg bone, and the only thing numbing the pain is wine. This isn't torture. It's ancient Roman medicine. Picture you are lying on a stone table in ancient Rome, 158. Your leg has been shattered in a gladiatorial combat, and gangrene is setting in. A medic approaches with a bronze saw, its teeth glinting in the lamplight. There is no countdown, no smooth descent into unconsciousness, only the terrifying reality of what you will experience every second of what is about to happen. This is not a scene from a horror movie. It was everyday medical reality for millions of people in the ancient world, where surgical operations were performed with primitive tools, simple herbal remedies, and nothing but human endurance. The first 30 seconds of any ancient operation were crucial, not for the surgeon's technique, but for the patient's survival. Many people died of shock before the operation even began. The psychological trauma was so severe that some patients' hearts simply stopped out of fear. An arsenal of torment. Roman surgical instruments. Roman surgeons were not barbarians. They were experienced practitioners working with the best technology available to them. But their instruments, although sophisticated for their time, were primitive by modern standards, and were designed for procedures that would make today's surgeons cringe. The Roman scalpel, or scalpel, was surprisingly similar to modern versions, a sharp, thin blade attached to a bronze or iron handle. But without anesthesia, even the smallest incision was a painful ordeal. Patients had to lie completely still, while surgeons made deep incisions into the skin, muscles, and sometimes even bones. Roman medical texts describe how patients were held down by several assistants, their limbs tied to the operating table with leather straps. Extreme precision was required. One wrong move while the patient was writhing in pain could be fatal. Saws. A symphony of suffering. Perhaps no instrument struck fear into patients' hearts like the bone saw. These were exactly what their name suggests: serrated metal instruments designed to cut through human bones. Roman bone saws were usually 15 to 20 centimeters long and had coarse teeth that required considerable force to operate effectively. The amputation process began with the surgeon making circular incisions in the skin and muscles, layer by layer, while the patient remained conscious. Only when the bone was exposed was the saw brought into play. The sound alone, the grinding of metal teeth against bone, was reportedly enough to cause some observers to lose consciousness. Archaeological finds at Roman medical sites have uncovered bone saws with traces of human bones still stuck in their teeth. Silent testimony to procedures performed nearly 2,000 years ago. When surgical bleeding could not be stopped with pressure or bandages, Roman surgeons resorted to cauterization, literally burning the wound with a red-hot iron instrument. These cauterizers came in various shapes and sizes, from simple rods to special curved instruments designed for specific parts of the procedure. Was as brutal as it sounds. The iron instruments were heated in braziers until they were orange hot, and then pressed directly onto the bleeding tissue. The sound of burning flesh sizzling was accompanied by smoke, and the characteristic smell of charred human tissue. Patients often lost consciousness from the pain, which surgeons considered merciful. Roman doctors were not heartless. They understood the suffering of their patients and desperately sought ways to alleviate it, but their options were severely limited by the medical knowledge of the time. Opium, derived from poppies, was the most effective painkiller available to the Romans. However, it was extremely dangerous. The line between a therapeutic dose and a lethal overdose was very thin, and many patients who survived surgery died from opium poisoning. Roman medical texts show that surgeons often faced a dilemma: give too little opium, and the patient could die of surgical shock. Give too much, and they might never wake up. Poppy extract was usually mixed with wine and given orally, but its effects were unpredictable and often insufficient for serious operations. When opium was unavailable or considered too dangerous, surgeons relied on alcohol and herbal mixtures. Patients were given large amounts of undiluted wine in the hope of achieving a level of intoxication that would dull the pain. Another popular remedy was mandrake root, which contained alkaloids that caused drowsiness and mild pain relief. However, like opium, mandrake was dangerous. An overdose could cause hallucinations, convulsions, or death. Surgeons had to rely on guesswork and experience, with no scientific understanding of dosages or drug interactions. Some Roman surgeons used physical methods to minimize pain, including squeezing nerve points or arteries, to temporarily reduce sensitivity in the area being operated on. While this provided some relief, its effectiveness was limited and could not eliminate the underlying horror of the operation in the mind. Roman surgical procedures were performed under conditions that would horrify modern medical professionals. Most operations were performed in the surgeon's home, in military field camps, or sometimes in temple complexes dedicated to healing gods. Lighting was provided by oil lamps or natural sunlight, which meant that many procedures had to be scheduled during daylight hours. The operating surface was usually stone or wood, which made cleaning easier but did not provide comfort for patients. Cleanliness, although recognized as important, was limited to basic washing with water and wine. The surgical team usually consisted of a chief surgeon, 1 or 2 assistants, and several strong individuals whose job was to hold the patient down. Medical instruments were cleaned between patients, but sterilization as we understand it did not exist. Roman surgery was rarely a private affair. Medical students, other doctors, and sometimes family members or curious onlookers gathered to watch the procedures. This meant that patients endured their suffering in front of an audience, adding psychological trauma to their physical pain. Some descriptions of surgical operations mention that spectators became ill from the sight and sounds of the procedures, with fainting and vomiting being common reactions. However, these observations were extremely important for medical education, as there were no textbooks with detailed illustrations of surgical operations. Cataract surgery, precision under pressure. Roman ophthalmologists performed cataract removal surgery using a method called cutting, which involved inserting a sharp needle into the eye to push the clouded lens out of the visual axis. Patients had to remain completely still during this delicate procedure, knowing that any movement could result in total blindness or even worse. The psychological pressure was enormous. Patients saw the needle approaching their eye and had to place their complete trust in the surgeon's skill, fighting the natural instinct to pull their head away. The success rate of the operation was low, but for those on the verge of total blindness, it was often their only hope. Trepanation. Drilling into consciousness. Perhaps no ancient surgical procedure was as terrifying as trepanation, drilling holes in the skull to relieve pressure or treat traumatic brain injuries. Roman surgeons used a variety of tools, from simple drilling devices to more sophisticated traphenes, with circular cutting edges. The procedure began with shaving and cleaning the scalp, after which the drilling site was carefully measured, and then the drilling itself began, a slow, methodical process that could last an hour or more. Patients remained conscious throughout, hearing the scraping of metal against bone, feeling the vibrations through their skulls, and knowing that one mistake could mean death or permanent disability. Archaeological evidence shows that many patients who underwent trepanation survived the operation, and the skulls showed clear signs of bone healing around the site of the operation. This suggests that Roman surgeons achieved good results despite the horrific nature of the procedure. Military surgeons in the Roman legions were particularly skilled at amputation, as wounds sustained on the battlefield often left soldiers with mutilated limbs that threatened their lives due to infection or blood loss. The amputation process followed a careful protocol. First, the limb was tightly bandaged above the amputation site to reduce bleeding. Then, circular incisions were made in the skin and muscles, working layer by layer to leave enough tissue to cover the bone stump. Cutting the bone itself was the most painful part. Roman bone saws required considerable pressure and several strokes to cut through large bones such as the femur or humerus. The patient was held down by several assistants while the surgeon worked as quickly as possible, knowing that prolonged operations increased the risk of death from shock. Finally, large blood vessels were cauterized, and if the patient survived, the wound was carefully sutured and bandaged. Recovery was lengthy, and infection remained a constant threat, but successful amputations saved lives, and sometimes allowed patients to return to psychological trauma. Helps us appreciate the mental anguish experienced by the patients of ancient surgeons. The anticipation of surgery was often as devastating as the procedure itself. Patients awaiting surgery in ancient Rome often spent days or weeks knowing what lay ahead. Unlike modern patients, who can expect to be unconscious during the procedure, Romans had to mentally prepare themselves for what they would experience every minute of the operation. This anticipation often led to what we would today call severe anxiety and depression. Some patients refused surgery altogether, preferring death to the prospect of conscious surgical intervention. Others attempted suicide to avoid ending up on the operating table. During the operation itself, patients had to draw on reserves of mental strength that most of us cannot even imagine. Roman medical texts praise patients who remained calm and cooperative during surgery, indicating that such a level of self-control was rare and greatly admired. Some sources describe how patients read prayers, philosophical treatises, or poetry during surgery to distract themselves from physical pain. Others bit leather straps or wooden objects to prevent themselves from biting their tongues. The psychological impact of being tied down, surrounded by spectators, and subjected to severe pain while remaining conscious, created trauma that lingered long after the physical wounds had healed. Surviving ancient surgery meant living with vivid memories of the experience. Unlike modern patients who wake up with no memory of the procedure, Roman patients who survived surgery remembered every detail, every moment of pain, every sound and sensation. This often led to long-term psychological consequences that modern medicine would recognize as post-traumatic stress disorder. Some patients became unable to tolerate any medical treatment, while others developed phobias related to their surgical experience. Roman culture placed great importance on stoicism and endurance in the face of adversity. This cultural foundation provided some psychological support to surgical patients, who could view their trials as an opportunity to demonstrate virtue and courage. Stoic philosophy, which had a huge influence on Roman society, taught that physical pain was something external to the true self and could be endured through mental discipline. This allowed patients to view surgical intervention not as meaningless suffering, but as a test of character. Some Roman sources describe patients who refused any means of pain relief, viewing surgery as an opportunity to prove their commitment to stoicism. Although this seems extreme by modern standards, for these people it gave meaning and control over the situation during times of trial. For Roman soldiers, undergoing surgery without showing weakness was considered a sign of military valor. Veterans who survived serious surgical procedures often gained respect and authority in their units, especially if they remained calm and cooperative with doctors during the operation. This military culture of endurance probably contributed to the relatively high success rates of Roman military medicine. Soldiers were psychologically prepared for physical hardship and pain, which made them more likely to survive surgery than civilian patients. Roman surgeons were at the forefront of medical knowledge of their time, but this knowledge was severely limited by their understanding of anatomy, infections, and pain management. Roman doctors had a relatively deep understanding of human anatomy, gained mainly through observation during surgery and the treatment of injuries. However, they lacked knowledge of the functions of the nervous system, and many other physiological processes that modern surgeons take for granted. This meant that many surgical decisions were made based on incomplete information. Surgeons were able to perform complex operations successfully thanks to their skills and experience, but they could not fully understand why some methods worked and others did not. Perhaps the greatest limitation faced by Roman surgeons was their incomplete understanding of infection. Although they recognized that some wounds festered and that cleanliness was important, they had no concept of bacteria or the actual mechanisms of infection. This led to countless deaths from what today would be easily preventable post-operative infections. Patients who survived the trauma of surgery often died within days or weeks from infections that modern antibiotics could easily cure. Despite all their efforts, Roman doctors never developed truly effective methods of pain relief. They noticed that certain substances could reduce pain and induce sleep, but they lacked the scientific basis to understand how these substances worked and how to use them safely and effectively. This meant that the primary horror of conscious surgery, experiencing painful procedures while fully conscious, remained an unresolved problem throughout the Roman period. The history of ancient Roman surgery is, ultimately, a story of remarkable human courage, both on the part of the patients who endured unimaginable procedures and on the part of the surgeons who dedicated their lives to healing despite the limitations of their tools and knowledge. The patience of Roman surgeons demonstrated a level of endurance that challenges our modern understanding of the human capacity for suffering. Their experiences remind us that people can endure much more than we usually imagine, especially when driven by the hope of survival or healing. The development of modern anesthesia and pain management is one of humanity's greatest achievements in the field of compassion. The ability to eliminate the suffering associated with necessary medical procedures has changed not only medicine, but also our attitude toward physical pain and healing. Understanding ancient surgical techniques helps us appreciate the remarkable progress of modern medicine and honor the courage of those who suffered and labored to advance medical knowledge in centuries past. Every modern surgical patient who peacefully falls asleep under the influence of anesthesia owes a debt to countless people who underwent surgery while conscious, in order to advance our understanding of the human body. The screams that once echoed in Roman operating rooms fell silent centuries ago, but their legacy lives on in every modern operating room, where patients sleep peacefully during procedures that would have been unspeakable ordeals for their ancient ancestors. Roman surgery without anesthesia epitomizes both the horror of medical necessity and the triumph of the human will. Patients who underwent operations while fully conscious and aware of what awaited them demonstrated courage bordering on the incomprehensible. Surgeons who dedicated their lives to healing, despite having to inflict terrible pain in the process, showed a dedication to their craft that transcended the limitations of their era. Today, benefiting from centuries of medical advances, we can honor the memory of these ancient pioneers by remembering their sacrifice and continuing to expand the boundaries of compassionate and effective medical care. The transition from screams to silence in the operating room represents one of humanity's greatest victories over suffering, a victory built on the courage and self-sacrifice of countless individuals who underwent surgery without the mercy of unconsciousness. Their trials helped lay the foundation for modern medicine, and their memory reminds us that progress is often achieved at a cost paid by those brave enough to endure what seems impossible. By understanding their experiences, we gain not only historical knowledge, but also a deeper understanding of the remarkable journey that has taken us from the torments of ancient surgery to the gentle sleep of modern anesthesia.